Pretty close.
Pretty close. Yeah, it's
Yeah.
tough. It
So,
doesn't seem like
oftentimes that'll be obviously worse on the right
yeah, that makes sense.
for a lot of people. And then that means that this one, so that's a quick one to just get a sense of, is it obvious that there is, I think, less IR on the right?
Yeah.
And I think you can get more out of it by doing both at the same time than actually doing one, because there's so many ways to compensate with the one.
That makes sense.
But you can kind of take that through, I guess, a pillar of assessment, depending on how much compensation you see. So if you just have somebody like do a scratch test, like reach behind their back, don't give them any cueing, and it seems like both of them are pretty free, then you can just do the one maybe where you add a little extra reach. And if that's too complex for someone, then I think going the FMS route can actually be helpful, because the reach out this way and the arm going overhead tends to do exactly what you're asking someone to do by reaching behind. It takes too much of the rotation out of the mix too. And I've just seen that be sort of obvious for asymmetries. And you can go from there. But I don't tend to use it too much for what's going up top. I just don't feel like this.
Like, yeah, put in your IR.
Flexion and ER would be a better measurement for that.
That makes sense.
I'm trying to think of any others. So then, yeah, let's go into some of the ground sitting positions. But I think to your question about the FMS, right, you can see how a lot of the measurements that we're doing here, right, would fit into the FMS. They just have a different overall intention. And now you just might have more information of how to use that. So you have somebody that's coming in, especially as a training client. I still think the FMS is fantastic. It's like a great icebreaker, really. It's like a movement icebreaker. But just being loaded with the knowledge you have now of what does a full squat look like? What does a 3 squat look like? Do you know the terminology for the scoring of the FMS? Right. So like if somebody's got a 3 squat, maybe they're a narrow. You can't make that jump, but like you might start to think about that a little bit. There's a possibility there. And then you can kind of get a gauge of someone's body type and putting those two together. If somebody can go heels elevated, so they're a 2 squat, then you have some information of saying like, okay, maybe they need a little bit more supination just to get down there. So for you, I would love to actually do like the FMS squat test on you to see, can you get all the way down? Are you a 2 squat or are you a 1 squat? I know you're not a 3 squat, but like that would be something that I might take into my next line of assessment.
Okay.
And you can just see how they work off of each other, right there. So then the hurdle step could be similar to like a load propulsion test. You just have more now you're working with in your head. And the ultimate intention of the FMS is not to diagnose or to go real deep. It's just to get a screen of, is someone ready to train certain movement patterns, and like how do you want to treat this person within that movement pattern? Do you want to refer them out if there's pain? Do you want to just totally like clean up their movement and don't even come close to conditioning a movement? Do you need to be just careful, or can you just go like all in in a movement? And that's really the 0 to 3 training. And I don't think that there's much validity or reliability in the actual like overall score that much. I mean, there was some research on risk for injury. I think if it was like a 14 or something like that, but
with like
there's been a lot of that's changed over time. So if you're in a group, it might be more important to use some of that normative data that you're just gathering on your team. But I do think of it just like one movement at a time. You have that, kind of red light, yellow light, green light idea of a certain movement pattern. Then you take what you're getting from, the idea of expansion, compression, the difference between like a hinge and a squat, all of that information that you're getting, and you can get a lot right in the FMS. Right? So think of something like the rotational stability. like the connection there is how well can somebody rotate in a relatively easy movement there. So look at somebody that's a narrow, you should find they can connect pretty easily. Their stability might suck a little bit doing it though, but they should be able to connect pretty easily. A wide might have difficulty connecting there.
Yeah.
Right. So that's a possibility. You may have to take that farther, but if you're seeing that, you can start to put that together with some of the other things that you may have found. So, I haven't given this a ton of thought specifically, but it's there. So if you look at somebody who has a 2 or like a 2 squat, and then they can't connect there, then maybe those two together help confirm a wide, right? Something like that. But it depends on the quality of the movement too. Like, can they not connect because they just don't have the mobility, or they just fallen over so they don't have the stability off the bat? So I think somebody that's a narrow might have more issues with the just stabilizing in the position when they go from 4 pillars of support to 2, or somebody who's a wide can stabilize there, but they can't connect no matter what. Right. And then connecting that to what you find in your squat, connecting that to what you find then into your hurdle step would be like, all right, they don't have the hip flexion they have to compensate into ER or IR pretty quickly. And then you can even look at that from the side, that they have to hinge, or they're just finding a way to get around that pure hip flexion. What you would find with a narrow there, though, is there's just a different quality of movement. They might still be working around the hip flexion, but not necessarily because they're super limited. It's just that as soon as they go from 2 pillars of support, 2 feet on the ground, to 1, they just lose their body position, because, like I used the reference before, there might be more of a trying to herd cats type of situation, where it's like as soon as complexity increases in a movement, the holding of a position just doesn't stay there. But it's you can tell that they have the motion. It's just that they can't stay in one position when something gets harder.
Yeah. Well, and then that would be almost assessing more the propulsion side of that test.
Right.
Like the downline.
Yeah.
Real quick. Cool.
And then I'm trying to think of the lunge position, the inline lunge. That'll look at stability and mobility as well. That's going to be looking more at the sagittal plane. All right. So for both wides and narrows, you will find limitations there. But again, it might be more along the line of like obvious orientation issues that you can see. And there just would be somebody who's wide, you can see more compression on the backside as they're going down. And someone who's narrow, they're just general like instability, hard to hold the position. But they also may just have like an anterior orientation of the pelvis when you're trying to get into that half kneeling position. So lunging and half kneeling, like you'll see, they can be very valuable tools. And the inline lunge is just a more dynamic version of that, I think, because you see the loss of position as you get closer to half kneeling, as you get closer to kneeling. But sometimes just being able to stabilize into the posture, you can get some information there. Mm-hmm. Okay, I'm trying to see if we could be more specific with how you view that. So a narrow will generally need more concentric action to stabilize their half kneeling position, right? They'll need to be kind of pelvic floor ascending, and those would be the cues that you're looking for. What I've seen with narrows that I'm visualizing would be more of like they can go into a certain straight line if you ask them to. It's just that they don't really have that proprioceptive awareness, where somebody who's a wide, they can't do it. Like it's pretty obvious.
Well, I was thinking for the narrow, maybe they struggle like getting at the bottom portion of that lunge and getting up.
And getting back up. Yeah, that would be the other thing too, is like if they have the proprioception to get down in the right line, there's going to be this tipping forward, just like you would see they can get to the bottom of a squat, but as soon as they stand up from a squat, there's a hinge to get back up because they can't go in that straight trajectory. So you would see that with the bottom of the inline lunge, but you also would see on the way down sometimes that there is a similar type of veering, right? They could probably get down there and comfortably kneel, but they might even be a little wobbly when they get into kneel, but they might have to kind of hinge forward a little bit to get down there, right? So it would look very much like you would expect a squat assessment to look for someone that's narrow, where they can get down there and sit, but that middle portion kind of sucks from a stability standpoint. Okay. And then what's the other one? The push-up test. So narrows, you'll see a lot of sway. You'll see maybe like zeros or ones. With that, you may expect to see higher numbers like 2s and 3s from your wides, but they might just start with that extension in the lumbar spine, but it doesn't worsen. That's actually a pretty good assessment there, to correspond the two. And I haven't done this. I'm kind of spitballing here a little bit, but I think it's helpful to connect them, because I think that's an easy, just 7 movement test. And if you can start thinking of multiple models coming together, it's just like, you don't have to pick and choose. You can use whatever you see. And then outside of assessments, just whenever you're watching somebody through movement, you just have more ways of connecting things. You don't have to be so specific with your assessment all the time. And you can be adjusting people on the fly and having a better idea of what they need on the fly.
It's like every rep is an assessment.
Exactly. But I've always liked the FMS better than the SFMA, just because one of the things that I found value coming out of school was we got a lot of what the SFMA is. I thought, like, we got a lot of this separating out active versus passive issues, and complex assessments from head to toe. But the FMS kind of simplifies things and allows you to think of things more globally. So I like using the FMS because of the simplicity of it. And then if you can add some of the deeper concepts of, the wide versus the narrow ISA, and, the counter nutation of the sacrum, which fits into that world, I think you're going to find a lot of benefit just with like simple assessments that way.
Yeah.
And then you choose to go deeper when you need to go deeper.
Right.
It's good to be able to do that, right? Like, so
yeah.
you want the specifics, but I don't know. I don't tend to use them that much, but I also am you see the model that I have, where it is less and less physical therapy over time and
Right.
more and more personal training. So I am getting progressively more hands-off later in my career. But I do feel like the understanding of the specific is helpful, but when you don't need to use it, it's good. It's like, I think people are in a better situation.
Right. Especially with, like, depending on, like you just said, who your client is, whether it's PT or training.
Yeah.
Or physical therapy, for sure.
Yeah, and I think when you're just running into walls with people from a pain perspective, or for some reason they're just not satisfied, right? It might just be that they were looking for more mobility, they were looking for more strength, more power. They're not satisfied. Well, then maybe it's time. Let's revamp, look a little deeper, right? And being able to do that will make you a very versatile clinician. And you don't even have to define yourself. Am I a PT or am I a strength and conditioning professional? And it's just like, I'm whatever you need right now, and you hope to be that. And then it's also from a marketing perspective, I think down the line is you look at what people do. There's a lot of people that do hands-on work in some way, where, whether it's putting needles in somebody, whether it's body work, using some type of modality like a laser, that you actually need that passive modality for. So I like to refer people out for that. And I want to be kind of the master at not having to go that deep with somebody and still getting them benefit. And a big piece of that is education, right? It's just saying, like, do you know what you're missing? Because a lot of people don't even know what they're missing. And as soon as you just start to point out something that they never thought of, well, now they're on a new path. And that can be mostly done hands off, right? So
Yeah.
having that ability to look from both sides, though, it's very specific, but then can you go really global too? And it's strange how hard that is when you've had an education of getting very specific. The deeper and deeper you get at understanding like the anatomy, it can be very hard for people to just step back and say, okay, that's great, but we don't actually really need that much. You just need to be able to like get into a position that you haven't tried to get into, and then just go back to like motor learning principles, right? It's just like progressive overload, or just desensitize your body to certain things. Okay. So let's pick up maybe even sometime this week. We might not even have to wait until next weekend, but I want to go over some of the ground setting positions. Let's not do it today because I'm sure you have other stuff to do, and as do I. But I'd like to take this assessment farther and develop something, between the two of us, take from some of the stuff that I put into my book. And I think there's an opportunity here for all the virtual stuff that we're doing to just try to create a nice model of assessment that works with hands off.
Mm-hmm. Cool for me. And hopefully my
and you'll be the case study.
My art, yeah.
You're a good one to see restrictions on. I think there'll be much more subtlety in people and other people, but you'll also hopefully be a good one to see if things are working if we start to prescribe some stuff.
Yeah.
How often are you working on yourself?
I mean, like I'll like prep before I lift or work out every day, and then maybe like once or twice the rest of the day I'll just do like some resets or something if I'm not feeling great. But yeah.
So I wonder if you would do well with just I have these gymnastic bodies, sort of like, they're called stretching routines, but it really depends on how you use them. They're getting you into different positions that are trying to promote harder things, right? So it's like middle split, front split, and thoracic bridge. But the movements are, you're holding postures or you're dynamically transitioning through postures. If you can tie in some of the things that you understand about where to expand, you're getting kind of very compressed in these positions. And there's a lot of repetition into the same types of compression. And then if you can find yourself being able to breathe into there, just something that's very general for you and versatile, because you need mobility in a lot of different places, would be helpful, as opposed to being real specific right now. Like I think that might actually help you more, or even just getting like a yoga practice, that not necessarily going to yoga all the time, but just having like a sun salutation that you do that incorporates some of these different areas that you're limited. And then just doing that like as a routine several times a week. So it's not just like one or two movements. You got the concepts down, but you just might need like to get your body into more compressed positions and then have to breathe out of them. Like I think that really helps me personally, and I'm definitely a wide, and been working on my mobility for years. It's definitely the best thing that I can do to make myself feel more mobile. And then if I get back into a lot of concentric oriented training, then I feel like I'm going back. There's a balancing act there. So it'd be good for you to have a program like that, or multiple programs that you can just be doing, and even like periodize yourself to have several weeks where that's more of a bias of your training, and just see how your body feels with that, and then jump back into something that might be more hypertrophy or strength or power oriented, and then go back and forth. Because you're done with sports now, right?
Yeah, I'm done with sports.
I mean, competitive sports, but it's just a different way to look at things, because you don't need the same things you needed when you were an athlete anymore. All right. So it might not have been a good thing for you to do then, but maybe it's a good thing for you to do now. All right.
Sure.
What I'll do is when I get off this call with you, I'll just send you over the stretching routines that I've been using.
Okay.
And see if they work well for you.
Okay.
And you see where you can fit them into your life too.
Sounds good to me.
All right.